Hi, my name is Vichelle Johnson, and I'm a senior biology major at Fisk University. This academic year, I've had the pleasure of researching one of my passions with the Meharry Medical College HBCU Wellness Project. My project is named Maternal and Infant Mortality in African American Women. As you may know, maternal or infant mortality is defined as the death of the respective parties within a year of birth per 1,000 live births. There are many economical factors that contribute to the fact that African American women experience maternal mortality 3 to 4 times more than their counterparts, and African American infants 2 to 3 times more than theirs. This has been a consistent truth supported by the fact that African American mothers and infants have had the highest mortality rate for years, a trend that continues and was only worsened by the coronavirus pandemic, due to lack of access to quality care and a strain being placed on many other socioeconomic determinants of health. The purpose of this project is to raise awareness among all groups, but especially African American men and women. The hope being that this awareness will not only help us improve self-advocacy amongst African Americans by better equipping them with the knowledge and confidence to speak up, but also better equipping providers and encouraging research and action on this front. This would include things like pursuing equity over equality, understanding that biological norms for African American women could be slightly different than baselines projected by a female of a different race, and many other things. The targeted audience for this research was African American women ages 18 to 25. In order to achieve the goal of this project, a Zoom event was hosted that included an introduction of myself, the project, and a health professional that is well-versed in the subject. It also included a survey before and after the presentation to measure the amount of knowledge received. The participants were able to ask questions and were also entered into a gift card raffle after survey completion. We had over 100 participants. 95% were African American women, and 5% were African American men, meaning we did indeed meet our targeted audience. 50% of participants, based on their pre and post surveys, learned something new. 30% of participants already knew some of the information presented on, even if only at a base level. All participants were equipped with at least 15 tips to better navigate that time in life when either they, a spouse, or another loved one becomes pregnant. And lastly, 100% of participants enjoyed the presentation, felt like the information was useful, and would like to learn more about it. Lastly, I'd like to acknowledge and give a big thank you to all who contributed to this project, which includes Fisk University, the Family Safety Center, HBCU Wellness Project, and of course, Dr. Naomi Jamal, who volunteered as our health professional. I truly couldn't have done it without their efforts and support. Thank you.